And welcome to another episode of the Rorschach Test Podcast. I am Terrell James. Today I have a very special guest with me, Dr. Nicole. How are you doing today?
I'm doing wonderful. How about yourself?
I'm doing pretty good, pretty good. Now, it's been probably, I think, about almost 2 months since I've done this podcast. And hopefully people are missing me. If not, then something's wrong. But I we are back. I am about to pick up the pace. I'm going to have my guest at least every other week now. I know before I was doing a weekly podcast, but I think that because we have so many different podcasts on the Relic Media now, we're probably going to kind of scale back a little bit with some of the podcasts, and it'll probably be an every other week thing. But enough of all of that. This podcast is about Dr. Nicole. So, Doc, so Oh, actually, before we do that, for anybody, in case it's your first time watching, what I do here at the Rorschach Test podcast is I put up a bunch of ink blot tests or Rorschach tests, and I ask my guests exactly what it is that they see. Based off of what they see, I connect it to their passions, what they do for a living, who they are as a person. So, Dr. Nicole, she actually does a lot of things, but we're only going to deal with two of them today. The reason we're only getting into two is because I have another podcast that I'm going to do, and she's going to be on that, whether she knows it or likes it or not. She's going to be there. And we're going to get more into her entire story on that other podcast. But for this particular podcast, we're going to deal with two things. We're going to deal with, actually, I'm going to let you tell me. I'm going to let you tell everybody, okay? So, for these two things, let everybody know exactly what it is that you do and who you are.
So, good evening, everyone. I first want to thank you, Terrell, for even having me as a guest on your show. It is truly an honor considering it's been about 2 months since you've done it. So, yay, kudos for me.
Thank
For
you for being here.
Thanks for having me. I am professionally, I go by Dr. Nicole Wagner. I oversee three outpatient emergency department substance abuse programs, as well as overdose unit and one OB unit and an outpatient treatment center. And I also sit on the Baltimore City Mayor's Office Oversight HIV Needles Exchange Overdose Opioid Epidemic Oversight Committee Board. Also, I do a plethora of things. I'm also a plus size model and positive body influencer, and I am a mentor as well. So I'll just name those three things and save the rest.
Okay. So, what the two things we're actually going to deal with today are modeling and you overseeing overdose and substance abuse programs. Those are the two things that we're going to get. Now, we're going to definitely get into that whole mentoring thing when we do the other podcast. Um, okay, we are going to start here. So, what did you say that you saw here?
A deformed bug.
Deformed. I believe you said deformed. You said distorted
Distorted,
also.
distorted, deformed, yucky.
Yes. Yucky. Okay. So, all right. So when you so bugs, oftentimes people are afraid of bugs, right?
Mhm.
So I want to deal with fear. Also, you said distorted sometimes, or distorted or deformed. When something is distorted or deformed, sometimes it's hard to make out what it is. When we put those two things together, can't really figure out what it is, and fear, that really is anxiety. Oftentimes anxiety, it comes in the form of having a fear of something but not exactly knowing what that fear is. So I want to talk about anxiety. I want to talk about modeling, though. Modeling, how does anxiety present itself to you when it comes to modeling?
So anxiety presents to me in a couple of different ways, but the number one way is I'm always hoping that whenever I present on a runway or in any type of photo shoot, that the art that I'm putting together with the team is going to inspire some young girl that may be going through what I have gone through growing up, and some woman. And you never really know. For me, I'm never really sure people hear me and understand what it is I'm saying when I'm speaking. Then also just being accepted by the audience.
Okay. You said the things that you went through growing up. What kind of things did you go through?
I was teased a lot, bullied, called ugly, called fat. So I was definitely that female that did not want to see my reflection. I pretty much began to believe the things that people were calling me and saying that I was, so much so it spilled over obviously into my adult life, to the point where I would have the rental office remove any mirrors in my apartment or my house. I was not that person that wanted to see her reflection.
How do you feel now when you see your reflection?
Oh my gosh. It is like it's scary on one level, but it's so refreshing and breathtaking that I was actually able to come out of that rabbit hole, that unhealthy rabbit hole. So to see me now always taking a selfie, which obviously has a purpose with it, and no fear of being in front of a camera, that's mind blowing to me. And sometimes in the midst of doing it, I'm like, is this really me? And to actually like and love the images and the reflection staring back at me.
Hmm. Yeah. Um, Tell me a little bit about that process. I mean, as far as going from not liking what you see and then getting to a point where you do like what you see or love what you see. What happened that that helped you get to that point?
It was a combination of different things. I actually started my journey, my healing and discovering myself, in the image in which God created me when I had just started grad school. And I remember I wrote a blog that was called She Had to Lose Herself to
Hmm.
Find Herself. So, just a quick synopsis of what that journey was like. It was me victimizing myself. And what I mean when I say that is suicide attempts. My last suicide attempt was in 2005. And for those who know, I graduated with my PhD. And I mean, in 2015, I graduated with my PhD. So you kind of take that and you're like, wow, this educated woman still wasn't happy with life. So much so that my only out at that time, I truly, truly believe was ending my life. That's how bad the internal, emotional, and psychological pain was for me from earlier on trauma. Um,
Hmm.
and to actually have to confront myself, because the reality is the people that had done harm to me, whether it was physically, emotionally, or financially, they were no longer existent in my life. So it was like, was I going to continue to victimize myself or was I going to heal from that? And luckily, my foster mom, who was my worker when I was in foster care, loved me enough that she would pray with me, pray for me, because I was very resentful, angry with God, just kind of like questioning everything. Like, you're a loving God, but why would you let a child and anybody go through this? So it was confronting my own inner demons and having to deal with the reality that if I was going to live a life of quality, I couldn't wait on others to apologize and help me heal.
Right.
I had to take that journey myself. It was hard, it was painful, it was sometimes funny, and that probably sounds, a little bit crazy to the viewers, but in that darkness, I learned to laugh at myself so that others laughing at me no longer bothered me. So,
Makes sense. So
yeah.
self-preservation
Yeah, but
makes
it's
sense.
it's it's a hard journey because people have
Mm-hmm.
this image that healing looks pretty, or it looks like going to church, or it
Hmm.
looks like taking vacations, swinging your feet in the water. And my healing process was ugly, confusing,
Hmm.
resentful, But to be where I am today, it was necessary.
Right.
So in that blog, I wrote it during that journey. I was truly, truly lost, so much so I was putting myself in unhealthy, knowingly putting myself in high risk situations, whether it be relationships or whatever, harm's way. And you think about that because you know going into it, and you're like, why would you go into a harmful situation? But keeping in mind, that was all I knew. And to someone that doesn't know love or get attention, any attention is better than no attention.
Yeah.
And
True.
that
Hmm.
was the part that was hard. I had to forgive myself for all the wrong I had done to me. So it was a hard journey. And even today, I'm still on that journey.
Hmm. Okay. Um, I am. I'm happy to hear that you have come so far, but I'm also happy to hear that you're still on the journey because a lot of people need to hear that. Sometimes it's hard for a person to relate to a person who has completed the journey and has arrived. But what you're doing is remaining relatable. So to other people who are on that journey, you are giving them, you're encouraging them to stay on that journey and to keep fighting and keep, trying to attain their success or whatever it is that they're trying to attain. So that's a huge, huge thing right there. I know that they appreciate it. I'm going to tell you that I appreciate it. I know I'm speaking on behalf of them, but I feel that I can speak for them and tell you that I appreciate that um, very much. Okay, so I'm going to put this picture up again because I have another question. Okay, again, you said you saw a distorted bug here.
Hmm.
Okay, so on the other thing that you said you saw a creature. That was the other thing. When you told me, you said it's like either a distorted bug or a creature.
Yes.
So when I think of a creature, the first thing that comes to my mind is of something that is undesirable.
Hmm.
And but modeling is presenting something that is desirable. So I
It
want you.
depends on how you look at it, though. From my perspective, it depends on how you look at it.
Well, I look at it as first of all, I'm looking at it from a male's perspective, and when we look at models, we're looking at something that is desirable. Um, but but even from a woman's perspective, I don't want to speak for women. I'm just telling you what I think. I believe that when a woman is modeling and she's modeling something, she is showing other women, not only what she's wearing, what she looks like, but she's exuding confidence. And hopefully, that confidence is it's that the woman who's looking at you or that young girl who's looking at you is receiving that message from you and saying, okay, this is something that is desirable. And it doesn't have to be anything that is sexually desirable, although it's very easy to sexualize modeling.
Hmm.
But I think it goes deeper, especially with the type of modeling that you do and with who you are. It goes deeper. We have to peel back layers. This isn't just about something. This isn't just about sexualizing the body or sexualizing modeling. This is about confidence.
Right.
This is something that's goes far deeper than just sex and trying to sell sex.
Hmm.
So that right there is desirable, and that's what I mean when I say that it is something that is desirable. So looking at it that way, tell me about a time that something or someone tried to get in the way of you attaining something that was, well, attaining something that you desired.
Um, hmm.
Even if it's about modeling, I mean, if there was somebody or something that was just in the way, and this is something that you wanted to attain, something that you wanted to achieve, tell me about a time that something or somebody tried to get in the way of you attaining that.
So when I first started out modeling, I was a part of what was presented to me as being a woman empowerment and movement group. And I don't really know what happened, what transition within it. But for me, you go through an interview and I made it very clear I did not want to be a boxed in type model. And what I mean by that is if I wanted to model fitness clothing, um, urban wear, bathing suits, lingerie, whatever it is I put on, I wanted people to know that it wasn't, as you said earlier on, about sexualizing the individual model, but about making a statement and showing that all women, all ages, all sizes, heights, races are beautiful. She has to first believe it and know it for herself in order to exude that for others around her to
Hmm.
pick up on that. Um, and in this particular empowerment group, the CEO of it turned it into something very nasty and distasteful. So much so, she literally sent me from a business email, an email saying she felt as though a picture where I was in a two-piece bikini was too provocative. She and the brand ambassador of that group at that time, I mean, it was just like back and forth, back and forth. And it bothered me so much because, of course, earlier on, I'm still finding my own position in my own existence. So that was a big deal for me because I knew I did not want to send the wrong message to women and especially young ladies. That was not the message I wanted to send. So it caused me to start questioning myself and my purpose and intent for doing whatever it was I chose to do, as far as what I wore, what modeling, and that bothered me. I will not lie, I will be honest and say it bothered me so much. I thought about walking away from my,
Hmm.
and that was a hard thing because it was the movement was all plus size women, plus size curvy women, obviously. So coming from hearing that distasteful, judgmental criticism from another beautiful plus size woman that was supposed to be about uplifting other women and young ladies, that was very hurtful, very hurtful.
Do you think she was jealous of you?
I never even, I never, I purposely chose not to even entertain that particular thought. I just chalked it up to my presence made her and maybe others uncomfortable because there are certain people, men and women, in this world that you're not arrogant, but if people don't understand your journey and your truth for who you are, they will confuse your confidence
Hmm.
with arrogance. And I often wondered if that's what it was. I hope it wasn't jealousy, but,
Hmm.
but I hope it wasn't that. But that was scary because I literally for almost a year I stopped modeling. I didn't do anything. I just went ghost.
Hmm. What was it that made you get back into it?
Someone that I had met when I first started out modeling was like, hit me up on Facebook Instant Messenger and was like, hey, there's this African show. They're looking for confident, curvy, plus size women. I gave them your name. And just as I was getting ready to respond, my phone rang. And it was the young lady that was giving the fashion show. And I went. And even then, it was crazy because I went knowing I had to model, but that situation was still in my head. And I
Right.
was still questioning maybe, modeling is not for me because they had said some pretty hurtful things towards me. So it kind of triggered past negative, things that were said about me and to me. And then I met a young lady who later became one of the female photographers that I work with. And when she was there, it was almost like she had this bright light around her because I was looking for the restroom to try on an outfit. And I was so lost on the grounds looking for it. And I just stopped her out of all the people I passed. I walked right past them and went to her. And I think that was meant because come to find out that young lady was also on her journey doing photography and modeling. And that day, and I often tell her, she is the reason why I got back into it.
Hmm. Okay.
Yeah.
Yeah, it's good to surround yourself, whether knowingly or unknowingly, to surround yourself with people who can motivate you to just keep going. Sometimes it's hard for us to uh, dig down deep and find that motivation or that inspiration on our own. Sometimes we need something on the outside to motivate us or to keep us going. So it's good, and I feel like God knows when it we are unable to reach down and find that within ourselves, and He places people and situations around us, that allow us to get back to the path that we're supposed to be on. So
Yeah.
okay. All right, so I tell you what, let's move on to the next picture. So, okay, what did you say that you saw here?
So I see an ape with possibly water or something behind him. And at the bottom of that ape's feet, it looked like two eagles, one on each side.
Okay, so you saw an ape, water behind the ape, eagles at its feet. Oftentimes, when I show people these pictures and they tell me what they see, I can kind of make out what they say. I have no idea what you see here. I can't see it at all. Okay, I see the ape. I'm sorry, I see the eagles. I do not see the ape. I do not see the water. But that's the beauty of these things. I absolutely love showing people these pictures because everybody sees things differently.
Okay.
But okay, so you said you saw an ape, you saw water behind the ape, you saw eagles. Okay, let's start with the ape. So apes are very dependent on their vision. Okay, eagles are a symbol of freedom. I'm gonna come back to the water for the next question. So right now I just want to deal with the apes and I want to deal with the eagles, okay? So again, apes dependent on their vision, eagles symbol of freedom. Is there a sense of freedom that comes with your vision of modeling?
Yes. In all the years I've been modeling, I do not allow anyone or anything to compartmentalize me. I am very free spirited. If I want to model hypothetically a thong, then I'm going to do that, but I'm going to do it um, classy and tasteful. And it's definitely to know me, anything I do is very purposeful and it has meaning behind it. There was a shoot I did with the young lady I met at that fashion show I was telling you about earlier.
Mhm.
Um, we decided to recreate one of the most barbaric times during slavery, which is when they would just totally violate the black woman, expose her breast, even take the milk from her breast to feed to the white children. So in this particular picture, I have on a waist wrap, a sarong, and no top on, and my hair is really long. Her sister did my hair for me, and I'm in the water. And unlike the pictures from historical slavery times, you see fear, you see brokenness in these women that are exposed. But in the picture, whereas though she and I recreated, you see beauty, you see love, you see strength, um, you see freedom. And I'm kind of looking up in the sky, almost as if God is looking down at me and giving his blessings to me for what it is I do.
So is it safe to say that the type of modeling that you do, it all tells a story?
Yes, yes.
Okay. It was that your purpose when you got into modeling?
It was not. My purpose, first of all, I never saw me modeling. When it was suggested to me, I was like, heck no, because I'm a Tom girl. You give me some lip gloss, hoop earrings, ponytail in the head, tennis shoes or Tim boots, sweatpants, I'm good to go. So band heels,
Okay.
makeup and hair.
Okay. Got you. Okay. So what was it that made you decide that you wanted your modeling to tell a story?
So Before I got into modeling, I had started my weight loss journey. And in order to stay consistent, I became a fitness instructor. My first format I got certified in is called hot hula, which is Polynesian style dance fitness. And one of my students and just did a photo shoot with her this past Saturday. Um, she and other ladies in my class would all just come up to me and tell me how I inspired them, how they aspire to have the confidence in their existence and, with their bodies that I have. And I was like, okay, let me think about this, to know that, people are watching you for class, but you don't know they're watching you beyond just what you're teaching them in
Mhm.
class. And then one day, this particular student, she sent me a message inbox, and she was really hard on herself about her body. And what she said to me was, I wish I loved my body as much as you, because I wouldn't have a problem showing my stomach. Because for me, I wear the wrap, my midsection was showing, little crop top on, and I was comfortable with that. So I decided, I was like, you know what? I'm going to use all of my platforms to inspire women and young girls to embrace their bodies and perfectly perfect bodies as they are.
Mhm.
So I didn't know which direction I was going to go. I had met Wanda Reed, who is now my designer. I
Mhm.
had met her in that particular movement that I was sharing with you earlier. So as I knew I wanted to take modeling and be bold and daring with it, which I guess they call that risque as well, to leave my mark, she and I just collaborated, and we've been doing that ever since. And I was like, whatever I do, I want it to be tasteful. I want
Mhm.
it to be classy. I want it to have a purpose and to tell a story.
I want to ask you a question. You said it's considered risque.
Hmm.
Is it risque when women who are not plus size models do it? Do they still consider it risque when they do it, or is it only risque when the plus size models do it?
It's only taboo and risque and unacceptable when it's plus size women. And I'm very clear. I've always been very clear about that since I've gotten into model. Nobody has a problem with the quote unquote standard size body type woman having a thong on, or two-piece bikini, or doing a lingerie photo shoot. It is only something nasty and distasteful and risque if a non-conventional or standard acceptable size woman do it. And I'm okay with that as well, because historically, even with modeling, they preferred smaller women because they felt like the garment would hang on the body. Your body is a canvas. They felt like the garment would hang better on the
Mhm.
body of a smaller woman versus that of a plus size woman. But society standard and realistic standard, it totally different, because the biggest consumers of clothing, shoes, and makeup is your plus size women. We
Mhm.
already know that when we buy any type of garment, we're going to have to pay a little bit extra for that extra double threading and the fabric. We know that going into it. So, how a two-piece bathing suit, I can have the same bathing suit as a smaller woman. It's not going to hang on her like it's going to hang on me. I have curves. I'm built different. And then
Right.
I have the attitude to match whatever I'm wearing. So, that's when it becomes quote unquote provocative and this risky, and that's why I have such a love for the artist Lizzo. Everybody gives her a hard way to go about what she wears. Then you turn around and you see a smaller woman wearing it, and the first thing they say is, oh, well, she has the body for it.
Hmm.
So it's the hypocrisy for me.
How does it make you feel when you hear words like taboo, risque, provocative when it comes to a plus size model, but those words are not used for a smaller model?
It used to really, really get under my skin, obviously, when I first started out, because I was in the dark, feeling my way through it, learning trial and error as I go along, and I had to develop some thick skin. It's like when
Mhm.
anything you do in life, you have to commit to it and commit to it in such a way that you know not everybody's gonna be open to it. Not everybody's gonna accept it. And I had to teach myself to be okay with that. And the way I did that was I constantly reminded myself of I'm not doing it for that size woman. No shade. I think all women are beautiful, but I'm representing plus size woman. That little girl that was told she would never turn her head, get a boyfriend because she's too dark skinned, big lips, she fat, or whatever the case may be. That's who I'm trying to appeal to. So it's all about perspective and understanding. I understand that my targeted audience is not society's standard audience, and I have to be okay with that. And I am, and I laugh at it now.
That's
It's
good.
funny because
Okay.
behind the scene when they really want to sell clothes, they want us plus size women. Yeah,
Right. Yeah. Yeah. Because the majority of the women don't look like the models. You know,
right.
the majority of the women, they have extra weight that they carry. The majority of the women have cellulite and stretch marks. They are real women. And
Correct.
I know, and I can't speak for all men. I'll speak for me and the men that I know. That's what we want. That's what we like. you know, that's what we are attracted to. So I know that what you're doing, you were giving hope and inspiration to a lot of young girls who are full figured or who may have some sort of issues when they look in the mirror. You're giving them that hope. But from a male's perspective, we appreciate it as well because it's something that we desire. Again, going back to that word when I was talking about it earlier, modeling being something that you're presenting that is desirable. That's something that we desire and that we love to look at. At least the men that I know, anyway. I can't speak for all of them, but the men that I know, that's something that we appreciate as well. But we don't only appreciate what you're presenting. We also appreciate the confidence. We appreciate the confidence. We appreciate the journey, where you were and where you are now. We appreciate that too. So I'm going to say on behalf of the men that appreciate this, thank you. Okay. Okay, so I'm going to put this picture back up again. So I got another question about this picture. So again, you said you saw the ape, you saw the water behind the ape, and you saw the eagles at the ape's feet. So now I want to switch gears. You said that. So you are an overseer of a substance abuse program.
Yes.
You deal a lot with people who are addicts.
Yes. And I did
So,
it fresh from the street. So I oversee the emergency department programs for three different hospitals. And one of the
mhm,
hospitals, I also oversee the OB substance abuse program.
okay. So now you said an ape, but I'm going to switch that to monkey. The reason I want to switch that to monkey right now is because I've heard addicts themselves refer to their addiction as a monkey on their back.
Mm, okay.
Um, the water that you saw behind, so water, it gives life. Water gives life. The eagles, again, I'm going to still stick with that representation of freedom with eagles, okay? Now, I'm going to put all of this stuff together. So, explain to me the type of compassion that it takes to understand when a person that has a monkey on their back has turned their back on the thing that gives them life. That's the water. They turn their back on the thing that gives them life and essentially turn towards something that gives them a false sense of freedom. So, what kind of compassion does it take when you're dealing with these types of people who they're fighting this addiction?
Mhm.
We understand that addiction is a disease. This isn't something that they chose to have. This is a disease. Um, but still, there are, even in deciding not to have the addiction, there are still decisions that are made. And there is the decision to deal with the substance.
Mhm.
So when you're dealing with that, you have to have a certain level of compassion with dealing, with these people who are suffering from addiction. So tell me, how does it feel? What does that look like to you? What does it make you feel like when you were dealing with somebody who, and actually, I want to speak more so to the compassion that you have. What place does it put you in when you have to have that type of compassion for a person who's dealing with that monkey on their back, and they've turned away from the thing that has given them life and turned towards something that has given them a false sense of freedom?
It first starts with me being non-judgmental.
Hmm.
It's very heartbreaking for me when I hear people refer to those individuals as junkies, or I see them exploiting them by recording them without their permission and uploading the videos, because nobody is born into this world and decide. I think when I reach a certain age, I'm gonna become an alcoholic, or
Hmm.
I'm gonna become addicted to either prescribed or non-prescribed illicit substance. So it first starts with me knowing that at any given second, it could be me on the other side. I also approach it because I have family members. We all do. People just don't like to acknowledge it. I have
Hmm.
family members that suffer from the disease of alcoholism and drug addiction. I have a sister that every now and then I go downtown where she dances at, and I'll get her food and I just sit with her. And she doesn't even remember me. And I know the pain that she was going through that led her there, similar to how I shared earlier on in this conversation that my pain led me to attempting multiple suicide attempts. Her pain and darkness led her to illicit drug use. Um,
When you say what way she dances, do you mean exotic dancing?
yes, to
Okay.
support her habit, that's what she does.
Okay.
And then I sit across the desk, because I'm also a counselor. I sit across the desk from these men, these women. And I mean, these are people that doctors, lawyers, used to work for the sheriff department, nurses, teachers. These are educated people. The falsehood and belief that addicts are lost hope individuals, nobodies, that couldn't be further from the truth. I have some of the best intellectual conversations with some of my patients, and they something happened and shifted in their life that led he or she to that path of saying as though the drugs or the alcohol is the only way they could continue to live and exist in this world. And it takes patience, because it may take 1,000 times of talking to this person and trying to encourage this person and be a light of hope for them. But it is that 1,001th time that he or she may get it. In dealing with the pregnant moms, I not only have one patient. If they're pregnant, I have two. If they already have children, however many children they had plus them, that's how many patients I have. And I see them as the human beings that they are. And my main purpose is to let them know that they are human, they do matter. They are loved. God has not given up on them, and that at any moment they can change their mind and accept the help. So it takes a lot of patience. It is emotionally draining, because you always want to. Me, I'm a helper. I'm a giver. I'm a problem solver. That's me. And unfortunately, in this field, I have no control over that. So I take a lot of that, their internal pain. They're numb to it, but I see it, I feel it, and I take that pain on. So it also takes discipline not to take on more than what I can handle. But the biggest reward in doing this work, and I've been doing this for well over 23 years now, is when I see that person transition into a new improved he or she, and some of them become counselors. All of my staff that I employ are in recovery. So to see these individuals where they are in their life, and now they're giving back what was once given to them, and most of them didn't receive it the way that they're giving it to others. So here we have all these vessels of change, hope for individuals. It's heartwarming, but it's hard. I wish I could say that it's easy and that I look forward to it. I love what I do, but I don't look forward to it because I know I can predict the main patients that are going to be on my desk when I go into the office. And that's heartbreaking. But it definitely takes patience, humbleness, and awareness of knowing that nobody's exempt from it. Me, you, nobody.
So, okay, I'm sorry. I want to stop you right there just because I feel like you're leading into, you're already answering the next question that I have for you. So, but I want to show the next picture first before you go any further. So, what did you say that you saw here?
That looks like a mess. One big spill that splattered places.
Okay, a spill. So you say you saw a spill. Okay, so I imagine working with people who suffer from addiction can be mentally and emotionally taxing on
Hmm.
you.
Hmm.
If I was to tell you to spill your guts when it comes to working with addicts, what exactly would you say?
Honestly, frustrating. That's my truth, is that I get so frustrated. I'll know that Johnny has the potential. Johnny knows everything that he needs to do. He knows what he's already lost. He knows what's at risk. He knows the high risk behavior he exudes that could lead him either in a grave, in a hospital fighting for his life, or in a jail cell. But he keeps doing it, and just when I think I've reached him, I only have however many hours I'm at work to plant seeds in a person. And just when I think I've done that and it's starting to grow, to then have to clock out, come home, and then hope that whatever I said to Johnny resonates and sticks with him until he gets to that treatment facility or place of refuge, only to go into work the next day and they're like, he overdosed again. It's frustrating.
Hmm. You said when you clock out, when you clock out, do you take your work home with you?
I
I
do.
mean, emotionally, you take it home with you.
Physically take it home with me and I take it emotionally home with me, so much so as times that I'll be out with my mom and she's like, do you ever not be at work? Because if my work phone rings, if it's a Saturday, Sunday, it can be 10 o'clock at night. I'm going to answer it. If they're like, hey, this person's ready to go, they just don't have a way, there's no account to pay for Uber to get them there. I'm like, how much is the Uber? I've paid for Ubers to get patients to treatment.
Hmm.
So, and that's not healthy, but I do it because I'm like, finally, something has clicked. The light bulb has come on, and I just want to catch them while they're in that moment of readiness. And you have to. That's the challenge. It's like being a track, running a race, and you ever feel like you're just running and you're not. It's like the hamster on the wheel, and you're not getting anywhere, and you're just running and running. And one day they just stop running. You like, got them. Let me help them while they're sitting still.
Hmm. Does it ever become overwhelming for you?
Yes. It's become so overwhelming that I've broke down crying. Um, at work, it has at times impacted my health to the point where I've gotten sick because I'm constantly working and working. And I've even had patients that are calling and be like, all right, Dr. Nicole, I'm ready to go to treatment. I'm like, where are you? Oh, I'm right here. Okay, stay there. Here I come. I've literally gotten up out of my bed and got in a car to go and get them and take them to the treatment place. Only for the treatment place to call me the next day or send me an email and say, hey, we did all the intake paperwork. We thought they were in their room and they left back out. So,
Hmm.
yeah.
Yeah, I can imagine that being overwhelming and frustrating, like you said. You're in a position where you're trying to help somebody who, in order for them to actually get help, they have to have the desire to want to help themselves. And sometimes, because of that addiction, they're not so inclined to, that they're not ready. Oftentimes, they're not ready. I've dealt with enough people around me that have had addiction. I know what it looks like. I myself have an addictive personality. I get it. I understand. But when you're dealing with somebody who is trying to, who they may even have the desire,
Mhm.
but sometimes that addiction is so strong. It's so strong that it just it really outweighs that desire to want to kick that habit. Also, especially if they're dealing with certain things in their life, a lot of people have been taught to self-medicate. And you have a lot of people who they don't necessarily use drugs or alcohol to feel good. They use it to stop from feeling bad.
That is true. That is 100.
And if they're still continuously dealing with things, then and this has been their way out. It's a false sense of freedom.
Mhm.
Going back to what I said earlier about that ego, it's a false sense of freedom. But regardless, if it's a temporary freedom, it works. It works for them. And I can imagine that being overwhelming and frustrating for you being on the other side where you just want to help. You see the potential. You see and you understand what it's like on the other side. The real freedom that comes, the health that comes, the clarity, the emotional availability to the people around them. There's so many things that just comes with being able to kick that. So I get it. I completely understand what you mean by it being frustrating and being overwhelming. But I
Especially
want.
the
I'm,
false narrative that people just wake up one day and decide to solve their problems with the use of alcohol or drugs. I just
mhm,
want to say for the viewers, that is not true either. I will say about 68% of my patients on my caseload became addicted to prescribed medication because they suffered from breast cancer.
mhm,
Um, they might have been in the military, and aside from the PTSD, they suffered a serious injury in the VA hospital, did not have the treatment to properly um, relieve them of their pain without them becoming addicted. So they became prescription writers. And I see it all the time using the CHRIS system. The patients are in the system as being on a drug treatment, medication assisted therapy program. And here you have this doctor that will prescribe 60 rocker sets to the patient. And it's not like they don't know. I'm like, come on, there has to be some accountability as well to the people that know these patients are addicts. But the first thing, you let them dictate to you what they want as far as treatment.
mhm,
And then there's the other component of resources. When people are making fun of these patients, oh, if they really wanted help, they would get help. Well, that's part true. But let's talk about the part that they have cut so much funding, whereas though programs have had to close their doors because they have limited funding. So resources is very essential. I can't send a bilateral amputee person seeking treatment to a facility if he or she is unable to do daily living skills. And this is factual
mhm,
stuff that treatment facilities, like, this is the questions when I'm on the phone and they're like, oh, do they have any criminal record? Do can they walk? And you're like, they had one leg or they had both legs amputated. Oh, well, we can't take them. And I've actually spent anywhere from 2 to 4 hours trying to find a facility to accept a patient that's ready. So
mhm.
for people that's just on the surface looking, and you're mocking people, that's someone's father, that's someone's daughter, someone's sister, someone's brother, and that's someone that's in your family as
Yeah.
well. And as a behavior health professional, I sit on a lot of different boards, and the main thing when they say, "Oh, well, what do you need?" I'm always like, resources. We need housing for the men. They do have housing
Mhm,
for women, especially if she have children. If she don't have children, in Baltimore City, there's limited housing for men.
hmm.
So
Why is it that there's limited housing for men?
I wish I had the answer to that.
Mhm,
Um, Now there's shelters, and the first thing I've heard people say, well, if they really wanted to get off the street, they go to a shelter. Again, I say to the viewers who don't know, let me give you the horror story behind it. They rape men just as well as they rape women in those shelters. They violate them. they still, what little bit of possessions that he or she have. And then some of them are unsanitary, like bed bugs used to be a real big thing. And
Hmm.
the shelter. So that there's a lot of contributing factors that make it really, really hard to assist individuals, even when they are ready. And everybody that's addicted did not decide to become addicted. A lot of them suffer from the disease of addiction because their doctor did not pay attention.
Okay.
And nobody wants to talk about that.
I'm gonna tell you something. There was a point in my life where I'm going to be completely transparent here, but there was a point in my life where I was abusing Vicodin, and I ended up having surgery. And I told my doctor at the time, I said, do not give me Vicodin because I've had an issue in the past where I was actually abusing it. And they gave me Vicodin anyway. And that right there, I believe, is part of the problem. Now, I did well with it. I very rarely took it. When I took it, I only took half of it, took half of the pill, and I only took it to help me sleep because I was having issues with sleeping. Because of I had ruptured my Achilles, and it was just having the cast on. It was just rough for me trying to sleep on my back. Um, so I would only take it to help me sleep, but um, I just wondered why, and that actually wasn't the only time that a doctor tried to push narcotics on me. When I went to the doctor for something, or when I went to the hospital for something, and I was in pain, and I would tell them, just give me Motrin, give me Tylenol, but don't give me any type of narcotics. So, is that something that you have run across where the patients or some of the people that you've had to deal with have told doctors, look, don't give me narcotics, but the doctors gave them narcotics anyway? And if so, what is it that the doctors are getting out of prescribing narcotics to people when they don't need them?
Financial kickback. Awesome. No one's ever thought to ask me that question. So
Hmm.
to answer the first part, yes, I have seen that. I've had patients that come to me and they're like, Dr. Nicole, I have to have surgery on my knee. I have to get a knee replacement. I don't want to take the medication. I'm like, how can I support you? That's the first thing I ask. How can I support you? Can you please tell them not to give me anything strong? If they give it through the IV, that's one thing, but I don't want to take anything home. Like I will even send them with on a company letterhead letter with my contact information. They will give them oxycodone, Percocet. I mean, and they give them the
Hmm.
strongest things. Or again, they look into the CRIS system and they'll see that individual is pharmacy hopping. And for the viewers that don't know what pharmacy hopping is, typically you see this behavior in addictive persons where the pharmacist would be like, oh, your prescription, it's not time to fill your prescription yet. You've taken all the pills within 2 weeks. It was a 90-day supply. So they'll go to Walgreens or whatever pharmacy they haven't been um, to get it filled. And here's the thing. I know people have probably seen the pharmacy reps that come and they visit the different doctor's office. And that's because they're like, hey, we have something strong on the market. If you prescribe X amount of prescriptions of this to your patients, we'll give you this financial kickback for it.
Hmm.
And I will use me. I've never been addicted to alcohol or any drug, but can I tell you that I have gone to the hospital and had surgery, and I will tell them I come from both sides of my family struggling with the disease of addiction and alcoholism.
Hmm.
Please don't give me anything strong. Can I tell you, they still give me the prescription for the strongest stuff, especially once they see you have private insurance. Oh, they give you all the best stuff.
Hmm.
One time they gave me fentanyl, even though I asked them not to, they gave it to me anyway.
Hmm.
So,
Yeah, yeah, that's unfortunate. I feel like, and I'm not speaking for all doctors and nurses, but I feel like with a lot of them, maybe growing up, they had this vision. They said, you know what? I want to be a doctor or I want to be a nurse because I want to help people. I want to save lives.
Mhm.
I want to, I want to add something to people's lives. And then they got paid. And
Mhm.
all of that went out the window. And they, it all of a sudden became about the money and not about the people.
And I always try to give all known sides of situations. The other component in regards to doctors is that doctors have a lot of patients. So nowadays, if you don't have a good relationship with your primary care doctor, you can walk into the doctor's office and say, "Hey, I've been having this back pain and it's been hurting for X amount of weeks. Normally in the past, I've taken oxycodone, such and such a milligram, like patients, I have it down to a perfect science. And the doctor will give it to them
Hmm.
without even doing a physical assessment exam to find out is some pain can be mental pain.
Right.
Me, I hate the dentist. I'm that person. You ain't even got to be touching me, and I feel something. If right, you can give me something the day before. Tell me, take it when I get on a parking lot. But you have to take time to truly, truly assess the symptoms that's being prescribed to it. I can tell you off the top of my head if somebody want to go and just have a doctor get them some painkillers, what to say to them. And if it's not a good doctor and if they're just rushing, and I call it paper pushing, to be able
Hmm.
to say I met my quota of patients I saw for the week or I saw for the month and I saw year to date or whatever, they'll go ahead and they'll write the prescription for you. Pay attention to your next doctor visit. He or she keeps a prescription pad in their lab coat or is
Hmm.
one close by in every exam room so that they can write a prescription for you. Never
Hmm.
really assessing to properly diagnose what's going on with you. That's why we have so many cases of misdiagnosis as well.
Right. Okay. All right. I got one more question for you. Again, I'm gonna put this picture up. You said that you saw a spill here.
Yeah.
Okay. So the saying "Don't cry over spilled milk." It refers to something that one isn't really a big deal, and two, something that can be easily fixed or cleaned up. Right.
Mhm.
Spilling milk isn't a big deal. Clean that up. No problem. Right. Has being an overseer of people, of a program with people who are addicts and suffering from addiction, has it made you look at your own life differently when it comes to crying over spilled milk? Meaning, have you looked at some things and say, you know what, at one point I saw that as a big deal. Now it's not that big of a deal when I see other people who have these other issues.
Yes, I have. My team teaches me a lot. I think they think I'm joking when I tell them either through email or when we have our monthly team meeting. I'm like, I thank you and appreciate you for the work that you do. Please know
Mhm.
that I don't take that for granted and that I learn from you. My team is very knowledgeable with life experiences. It has been times that I'm trying to engage a patient and complete an assessment to refer them. And a team member will come to me and say, I don't think that's the best level of care for them. And here's why. And I'm like, well, why do you say that? Well, when I was going through this, that's what I did. They're saying what they think you want to hear. So I learn a lot from them. Um, Listening to their stories, they're very transparent and open with me. And to hear some of their stories, like you said, all this time I've cried over spilled milk. And if I had to walk in their shoes, I can tell you hands down, I wouldn't want to. I'd be like, take your shoes back. I, I
Mhm.
don't know if I would have pulled through some of the situations that they came through. And if I did, I don't know if I would still have a kind heart, uh, a giving heart in the manner of which they do. You have to be a rare, unique type of human to go through the storm of addiction, abandonment, because oftentimes when people go through addiction, they burn bridges with family, friends, jobs, you name it. So to be in the world and in darkness by yourself, and you pull through and you leave the dirt on the other side, and here you are clean anew, and you're reaching back and you're giving back to other individuals, and not just those suffering from addictions. Like, my team go above and beyond, like they do more than what their job requires them to do.
Hmm.
I'm in awe of that. And I don't want to be that person that say, well, yeah, you know, I would be like that too, because I don't know. I thought my life was hard. But then when I hear theirs, I'm like, oh, that was small stuff that I was crying over.
Hmm.
So they keep me humble. They constantly indirectly force me to do self evaluations. And that's a hard part, because there's been times I've had to go back to my team and apologize to them. You know, I make mistakes as well. So it's humbling to work with them. And
Right.
yes, it forces me on a daily to self reflect and check myself.
Got you. Okay. I can see that. That makes all the sense in the world. Okay. So we are going to move to another part of the show now. This is, I call this part flip the script.
Uh oh. Wait a minute. What does that mean?
What I'm going to do is I'm going to turn all the pictures that I showed you upside down. I'm going to show them to you, but I'm going to tell you what I see. Based off of what I see, you can ask me, you can choose any one of these pictures and just ask me whatever question it is that you want to ask me.
Oh, let's go.
Based off of what I see. Okay. So,
Go.
all right. Here's the first one. So, this first one, you said you see a spill,
Mm-hmm.
right? Upside down, I see blood splatter. So, this picture is where you said you saw the ape. There was water behind the ape, and you saw eagles at the foot of the ape upside down. To me, it looks like an X-ray. The X-ray looks more like of a pelvis and chest. And then the last picture here, where you said you saw the distorted bug, the other way here, it looks like two bugs that are facing off, like they're about to fight.
Mm.
So, which one of these pictures do you want to choose to ask me a question?
The last picture. You flipped it
Were the two
upside
bugs
down.
facing off?
Yes, you said it
This
looks
one.
like two facing off and fighting.
Mm-hmm.
Why did you get
Okay.
that from the picture?
That's just what I saw. I mean, it just looks like two bugs, facing each other. And I'm gonna tell you something. When I first saw this, it kind of reminded me of boxing. So, I have a background in boxing. I'm a boxing trainer. I own a boxing team, and oftentimes well, not oftentimes, every time, that right before the fights, there's the face off. They're facing each other, and this that's just what it reminded me of. I just saw them facing off and ready to fight. I'm sorry I couldn't go any deeper with that one then.
That's actually because I do know that that's part of your background. That you're a man of many skills and talents. That's just one of many. So that's what I was. I was going to ask. The second part of that question is that picture and what you see in that picture a reflection of your life? But you've already answered that. So I should be able to ask you questions about all three pictures.
Sure, go ahead. What's up? We can. Okay, so this one, here's the blood
No,
splatter,
I want to ask you about that picture. Yes, stop rushing me.
and then the X-ray. Then
You said this picture turned upside down. Looks like an X and a pelvis.
yes.
Could you show the picture one more time for me, please? Okay. How is that picture a reflection? You could remove the picture, sir. Thank you.
Okay.
Is that picture is what you see in that picture a reflection of anything in your life that may be desirable to you? Ooh, that's a loaded question.
It is. It really is. Is there anything that is desirable to me? Um, I would say yes, just because with X-rays you look inside. You're looking inside of a person.
Mhm.
When it comes to podcasting and some of the other things that I do, me as a personal trainer, as a nutritionist, um, I tell you what, even deeper than that, it's a life coach. As a life coach and as a podcaster, more specifically, this particular podcast, Rorschach test, I have to go inside. I have to look inside of the person. I have to go inside of me as well.
Okay.
Because I have to pull from personal experiences and feelings in order to try to connect with the person, in order to come up with the questions that I need to ask the person. So yeah, that definitely is reflective of my life because and even like I said, with life coaching, with as a life coach, I oftentimes use personal experiences to connect with my people, with my clients, because I don't. I remember when I was in therapy. I'm still in therapy now. I probably will be in therapy for the rest of my life because I think that it's just an amazing thing. But I remember at a certain point when I was younger, I was about 17 years old, and I saw this therapist, and the therapy session was 40 minutes long.
Mhm.
But for 20 minutes, we sat there in silence, just staring at each other.
Mm.
And I was watching him. I'm trying to read his body language, trying to read his facial expressions. And it dawned on me that that silence that we were sitting in wasn't something strategic. It wasn't something where he was trying to figure me out. He didn't know what to say. So I asked him, I said, have you ever been through anything? Have you ever suffered? Have you ever felt any real pain? And he said, no, I really haven't. I said, so everything that you're saying to me when you are talking, because you were rarely talking, but when you are talking, it's all something that you just learned from a book. And he said, yeah. I said, then you're in the wrong damn business. Now, maybe he wasn't in the wrong business. That's not to say that you have to go through a certain amount of pain in order to be able to help somebody. You don't necessarily have to go through that pain to help somebody. But the point that I was making is the fact that he had never been through anything and he was only going off of what he learned in a book, it caused him to be dismissive. It caused him to be disconnected. And I couldn't, because he couldn't dig down inside of him, he wasn't able to get inside of me. He just wasn't able to do that. So when I became a life coach, I said I will never be that type of life coach where I'm not able to go inside and really help somebody and to just peel back layers and get past that surface. I said I will never be that type of person. And if ever I get to the point where I feel like I can't dig down, and I can't go inside, then it's time for me to walk away.
So as a life coach, you definitely use that skill set, but how do you disclose in order to meet one of your clients where they are? Because that's all part of building a rapport with your clients. You
Hmm.
want them to know that you can empathize, sympathize with them, but is a proper, I guess I'm looking at it more from a clinical stance, because in order for me to disclose about any type of hardship um, that I've gone through in my life, it has to be relevant to what myself and the patient is discussing, and it's
Right.
called proper disclosure. So at what point
Hmm.
as a life coach do you start to disclose to make that connection with your client?
Well, after they share their story, they tell me everything that they're going through. Um, and I want to be very clear. I don't stay on me for a long time because it's not about me. I give enough information to make it relatable, to make them comfortable, to make them know, hey, I know what this pain feels like, or I know what pain feels like. I may not know what your pain feels like, but I want to make it relatable. What I've learned is that it's easier for a person to receive something from you when they can relate to you. So, to answer your question, at what point do I do it? I do it after I identify what kind of pain the person is feeling.
Okay.
Once I identify the kind of pain that they're feeling, look, I've been through so many things that I can probably come somewhere near that. If it's not the exact pain, if it's not the exact situation,
Mm.
I can probably come somewhere near that.
Okay.
And if I can't come anywhere near that, which I can't even think of a time where I couldn't come near it, whether it's something that happened to me or somebody that was directly connected to me. And I mean directly connected to the point where I still was affected by it. Um, but yeah, I've always been able to connect through the things that I've through the things that I've been through. Um, and but yeah, to answer your question, that's when once I identify the type of pain that they're dealing with, that's when I do it. But I don't do it long. I don't do it long because I gotta let them know, hey, listen, we can connect, we can relate. Now that we're in the same boat, let's figure out how to fix this. I remember a quick story, real quick. I used to be in banking, and of course, the banks they want you to sell their products.
Mhm.
One of the things that I used to do, I would have somebody come and they let's say somebody wants they're interested in a money market account, right? What I would do is I would come from around my desk because I had two chairs. I had two chairs in front of me, in front of my desk. I would come from around my desk and sit next to them and say, okay, what is it that we need? Make it relatable. Make it seem as if, look, me and you, we're in this together.
Mhm.
Okay, now what exactly is it that we need? And they loved that so much, and it allowed them to just relax and say, okay, well, we need this, we need that. Because instead of me trying to sell them something, I was trying to figure out what is the best fit for us. So I just learned that, and I actually took that into life coaching. That type of mindset, I took that into life coaching because I said, you know what? Just relate to them, relate to them, and once you relate to them, it gets them. It makes it easier for them to trust you. And once people can trust you, they can receive things from you.
Hmm. Okay. So
All
you know
right,
I'm gonna ask
you
you
ready for that?
the last. Uh-huh.
That last one.
You
Okay, so
you blood. It looks like blood splatter. Now,
yes.
instantly when you see that, that's what you see on that picture. Of course, I instantly went
Mhm.
to your boxing background.
Okay.
So, is that why you see that, or and if not, share explain to me why you got blood from that picture.
It just looks like blood to me. I don't think it has anything to do with my boxing background. It just looks like blood splatter to me. That's it.
But
Um, what'd you say?
is the color is black? So I guess I didn't when I first looked at it, I didn't see blood because of the color. That was important to me.
Hmm.
The
Okay.
color. I was like,
Hmm.
that just looked like a spill, whatever
Hmm.
type of spill, but you got blood from that. It
Right.
could be milk, it could be paint, but you went right to blood.
Hmm. Okay. I see where you're going. Okay.
Right.
Um,
The spill, but you went to blood.
yeah. Maybe I need to go a little bit deeper with this as I think about why do I see blood splatter. Okay, so let's go to boxing. Not only boxing, I do Krav Maga and Kavana, other forms of combat. Um, very violent forms of combat, probably the most violent forms of combat. I've done mixed martial arts. I love combat. I do. I love fighting in controlled settings. I hate fights outside of that. I hate it. If I will not watch fights on social media. If I see some people about to fight, either I'm going to try to break it up or I'm just going to go the opposite direction. And I want nothing to do with it. I outside of controlled settings, I absolutely hate fighting. Now, if I'm forced into a situation, to a hostile situation, I hate having to get to the point where I have to spill blood. But once I'm there, I'm all for spilling as much blood as possible. Because with my training, the very first thing, especially with Krav Maga and Kavana, the first thing that I'm actually in the process of becoming a trainer with Krav Maga and Kavana. Um, I'm probably about 2 months away from becoming a trainer, but um, as a trainer, the very first thing that we teach is de-escalation. So my thing is with me, I de-escalate. I don't want any problems. Pride has to go out the window. Ego has to go out the window. All of that machismo, that testosterone, all of that, it has to go out the window. Because ideally, what we want is for everybody to go home with their lives, their freedom, their blood, their teeth. That's ideally, we want everybody to go home with all of those things. So I try to de escalate. So if I'm pushed to a point where I have to fight, it's because I already tried to de escalate. I tried to walk away from the situation and keep this as peaceful as possible. The other person has forced me into a position where I absolutely have to fight. So since I'm here, we might as well spill blood, and it might as well be a lot of it. I tried my best to avoid getting to this point, but since we're here, hey, let's paint the parking lot with your blood,
Their blood, not yours.
not mine.
Why not yours?
I mean, if they're good enough to do it, then okay.
I love the confidence.
Yeah, yeah, yeah. I mean, if they're good, I mean, look, I can't beat everybody. I can't beat everybody, so it could very well be mine. But what I'm talking about is my thought process going into this. My thought process going into this isn't that my blood is going to be spilling here. It's not going to be my blood splatter. That's not the plan. Because I'm gonna tell you something. I'll be completely honest with you. If I don't think I'm gonna win this fight, I don't want to fight. I got to get out of here. Okay. I know what I'm capable of doing. That's the thing. I know what I'm capable of doing. I know how well I can fight, how well I can defend myself. So if somebody can beat me up, oh, this is going to be bad. I got to get out of here. I can't do this. This is going to be bad. So yeah, that's why not mine. we gotta try to no, I don't want those issues. But even with people who can probably beat me, I feel like I have enough training where I can still make it a little difficult. Yeah, I feel like I can still make it a little difficult for them. But like I said, I can't beat everybody. Some of those fights are just and you know what? I'm gonna tell you something. The people who are trained, when it's very rare, if you see like social media or even people out on the streets, you don't really see people who are trained fighting. You don't see that
Is that because of
because
discipline? Because most professionally taught fighting
mhm,
techniques start with the teaching of discipline,
right.
self control.
That's why it's the discipline, and it's. I mean, we don't want to fight. We don't want to fight. This is. we do this for sport, or we do this for I mean, our livelihood. It could be business for us. But outside of that, I don't need to fight. I don't want to fight. I really don't. I hate it. I absolutely hate it, which is why I try my best to avoid it at all costs. At all costs. I was in a situation last month where actually not last month, March. It was St. Patrick's Day, where I very well could have just broken this dude's jaw. It was right there. He was out of line with what he was doing, and his jaw was right there, and I could have just I could have just broken his jaw, but I chose to take the peaceful route,
Okay.
and everybody got to go home with their freedom, their lives. I mean, it's a bar that I go to on a regular basis. I know the people in there. I don't want to be banned from that bar. Although I probably wouldn't have been banned because he was wrong. But still, I don't want to. Who knows? I could have come to that bar another time, and then he could have come there with people or with weapons.
True.
And now I'm in a situation where I'm either outnumbered, or they have weapons. Yeah, we do weapons defenses, but just because I am trained to protect myself against weapons doesn't mean that it's going to happen 100% of the time. It doesn't work that way. So I mean, there's no telling what else could have been avoided. And then I find out from the people at the bar, they're like, look, he's just drunk. He's not normally like this.
So,
And under different circumstances, the two of you all will probably be cool. I'm
right.
like, cool. If I see him again, then all right, cool. Maybe we can be friends. Maybe we can be cool. And I mean, who knows? Um, but yeah, like but I don't like fighting. When it's controlled, it's weird. I love combat. I do love combat. I love fighting. Um, but only when it's controlled. Only when it's controlled. Only when it's somebody else who is trained. I hate having to get to the point where I have to fight, where I have to fight. I always wanted to be just a choice, and but if I feel like I have to fight, I hate it.
But
I hate
for
it.
me, I, I'm, I've always been under the impression that when people learn different styles of fighting, one is because it's something they enjoy doing. Two,
Hmm.
in the event that they have to protect themselves or their loved one, that they're able to. But I believe in every situation, one should always try to, one, first de escalate themselves, because I believe you
Hmm.
can change the tone in any type of situation. Let me reframe that. In most situations, because someone that just has erratic behavior, it could be something else going on, and obviously you can't control that. But de escalation, self control, that's why I love in different formats they teach the art of discipline, self discipline.
Hmm. Right.
Yeah.
Yeah.
We
And
want
that's
you to
one
stay
of the things that I love about. What'd you say?
I said, and we want you to stay safe too.
Yeah. Yeah. Definitely. Yeah. We definitely want me to stay safe. Yes. Look. Listen. I am a podcaster. I am an actor. I don't need any marks on my face. Like I just, I need to keep this presentable. So yeah, absolutely, absolutely. Yeah. Yeah. All right. Well, look, we have typically my podcasts don't go this long, but you have you have such a remarkable story. There's so much more to your story, and I can't wait till we do this other podcast that I'm about to start soon. We're going to get more into your story because you're so fascinating. You have so many layers to you, and I allowed this podcast to go longer than I normally go, just because I was still peeling back layers and still trying to get more out of you. But I had to remind myself, hey, we got another podcast that we're going to do. So let's not divulge too much information in this one so that we can get into, the rest of the story um, on the other one. I personally, honestly, I believe that the other podcast that we do is going to be more interesting than this one because we're going to go deeper into your life and into your story. And from the things that you've shared with me about your story, boy, that's going to be a doozy. That's going to be a doozy. So I'm looking forward to that. But we're going to go ahead and we're going to wrap up now before you say too much more and we start going into the other podcast. So we're just going to end it here. But before we do, is there anything that you want to say to the people as far as if people want to get in contact with you as far as modeling, or if they're dealing with substance abuse and they may want to just reach out to you, how can people get in contact with you for either one of those things?
So, if you yourself or you know of someone that is in need of substance abuse and mental health services, you can reach me at, I'm going to give you two numbers. The first one is 443-306-1805. That is a personal hotline number that I also use. My direct phone number, work phone number is 443-695-2286, and that number stays on 24/7. Even if I'm unable to take your call at the time you call, please leave a message, a callback number. I myself or one of my team members will get back to you and provide you support. If you are interested in modeling and would like to work with me, I love working with new people, especially ones that have never modeled before. My Instagram handle is nwagner47, the number nwagner47. On Facebook, I am Miss Lovely, unapologetically me.
Okay, sounds good. All right, before we get out of here, I got one more picture I'm going to show you,
I
and
knew
I
it.
want
I
you
knew it.
I want you to tell me exactly what you see with this picture, okay?
Okay. This podcast is so dope. And it
And
is.
I couldn't agree more. Thank you so much. Thank you so much for your transparency. Thank you for your time. Thank you for what you're doing for the community. Thank you for the encouragement that you're giving young women, probably young men as well, or even older. It doesn't matter. Just the confidence and the encouragement that you're just giving to all of us. I appreciate it. I'm sure other people appreciate it as well. And you are actually making a difference in people's lives, whether you know it or not. You are a hero with
Thank
what you're doing, with both modeling and with being an overseer of people who are dealing with substance abuse. You were definitely a hero. When it comes to modeling, you could be changing somebody's life. Somebody could be looking at you. Some little girl could be looking at you and wanting to become a model, but they may not have the confidence to do it. And then they may just decide, you know what? I'm going to jump out there. I'm going to do it. And it could change their lives and it could change the lives of the people around them. And you did that. You started that. You sparked that.